Hi everyone, my name is Chloe if you didn't already know that, and today I will be presenting on a very important topic highlighted in a recent news article titled Nearly 500 Missourians Awaiting Court-Ordered Mental Health Services, an All-Time High, published by the Missouri Independent on October 27, 2025. The article addresses the extreme wait times people on trial are experiencing for their court-ordered mental health services. This article connects the overall topic of mental health and its connection to the system, specifically the prison system in this case. The article starts off with a discussion about how over the past few years, more people involved with the criminal justice system have been diagnosed with serious mental illnesses. Many of them require court-ordered psychiatric treatment in order to be declared competent to stand trial. However, the article highlights a pressing problem in Missouri regarding court-ordered psychiatric care, that there's now a record-breaking wait list of nearly 500 people stuck in a jail waiting for a psychiatric hospital bed or a treatment program to become available. And some of these people have been waiting more than a year. And I think it's important to know this isn't just a problem that Missouri's having. This is across the nation. But specifically in Missouri, this is because they don't have enough hospital beds or staff to treat them. So instead, people are stuck waiting in a jail cell. The article notes how in September of 2025, there was an average of 487 people on the wait list, which is a 33% increase from last year and almost double what it was 2 years before. Some individuals are being held in a jail without treatment for months or even over a year. The article highlights one person who had been waiting 469 days, which is completely absurd. While they wait, some get minimal services like medication or basic therapy inside jail, but they still don't get the full psychiatric treatment that they are promised. There has been some efforts to help with this issue. Like the article talks about how lawmakers in 2023 authorized the department to provide jail-based competency and programs that have been established in the St. Louis City and County and Jackson and Clay counties. This law allows outpatient treatment for individuals who can be safely released on bond. With this, they also expanded 2 mobile teams of clinicians who provide medication and case management to people on the wait list through in-person jail visits and telehealth. However, sheriffs and mental health advocates say that these efforts still aren't enough. Only 12 people have so far attained competency after completing a jail-based pilot program, according to the department, and 52 have participated. These mental health professionals and sheriffs argue that jails are turning into makeshift psychiatric hospitals, which obviously they were never designed to be. I think overall, the situation shows a huge breakdown between the mental health system and the criminal justice system. It's important to note that this isn't just a number problem. It raises many other concerns. First, ethically, it's troubling because people with illnesses like schizophrenia, bipolar disorder, or severe depressions are being kept in these jail cells instead of receiving treatment. We all are aware of how jails are portrayed and how they actually work, and they're noisy, stressful environments that often make symptoms worse. The article even touches on a sad case of a man who had waited months to be transferred into a psychiatric hospital. He ended up dying in the Kansas City jail in May. Was because he started harming himself and lost touch with reality after being detained. Also, legally, this violates the Sixth Amendment right to a fair and speedy trial. But unfortunately, if someone is mentally incompetent, their case gets paused until they receive treatment. And if that treatment never comes because there are no hospital beds or access to treatment, they're stuck in a legal limbo. They aren't convicted, but they also aren't free. They are just in a season of waiting. I think as social workers, it's important to see the social justice system's failure in this case. This isn't just an individual problem, but it directly reflects a failure of our mental health and legal system to accurately communicate with each other and create the resources that they promise in an effective way. This article directly relates to some of the topics we talked about in this course. Specifically, I think, like I said, the overlap of the mental health and the legal system. We learned the importance of understanding this overlap and how it can affect the populations we serve. We learned that mental health is not just a medical concern, but is severely affected by policy, stigma, and access to care. I think this article is a great example of how this can be applied in real life. It's a real life example of how these topics exactly intertwine. And like I said, this issue is directly affects the people that social workers serve, such as individuals with serious mental illnesses who are stuck in a jail waiting for treatment. As social workers, we may encounter this in courts, jails, hospitals, or just any mental health setting, wherever we decide to be, and we will play a key role in supporting these clients. Some things I'd like to note that we as social workers can do is, one, advocate for our clients to receive the treatment instead of being left in a jail cell. Also coordinating these services between the courts and the hospitals, working as in a way of case management, assessing and documenting mental health status, especially if a client's condition worsens while they're waiting in jail. And of course, crisis intervention if clients become suicidal or unstable in jail. And then lastly, and one of the most important things I think, is pushing for systemic change. Like in the mental health courts, more treatment beds or alternatives to incarceration. I think the bottom line is that as future social workers, we know that we're not able to fix the entire system overnight. Unfortunately, it's not how that works. But we can be the people who notice this and speak up for those who are unable to speak for themselves within the justice system. To close my presentation, I wanted to ask y'all's opinions on this topic and how you think we as social workers can advocate for changes within the legal system. Overall, just your opinion on this presentation. Thank you so much. Have a great day.